Hello friends, welcome to my channel Food and Fitness. Today we are going to discuss on breast cancer. Breast cancer is cancer that forms in the cells of the breasts. After skin cancer, breast cancer is the most common cancer diagnosed in women. Breast cancer can occur in both men and women, but it is far more common in women. There are several types of breast cancers like ductal carcinoma in situ is the presence of abnormal cells inside a milk duct in the breast. It is considered the earliest form of breast cancer. The symptoms are a breast lump, bloody nipple discharge, etc. Inflammatory breast cancer is a rare type of breast cancer that develops rapidly, making the affected breast red, swollen, and tender. Inflammatory breast cancer is considered an advanced cancer. What are the symptoms? Thickness or heaviness or visible enlargement of one breast, giving the breast a red, purple, pink, or bluish appearance, unusual warmth of the affected breast, tenderness, pain or aching, enlarged lymph nodes under the arm, above the collarbone or below the collarbone, flattening or turning inward of the nipple. Invasive labular carcinoma is a type of breast cancer that begins in the milk producing glands of the breast and have the potential to spread to the lymph nodes and other areas of the body. What are the symptoms? An area of thickening in part of the breast, a new area of fullness or swelling in the breast, a change in the texture or appearance of the skin over the breast appears, a newly inverted nipple appears. Labular carcinoma in situ is an uncommon condition in which abnormal cells form in the milk glands in the breast. It is not exactly cancer, but being diagnosed it indicates that you have an increased risk of developing breast cancer. What are the symptoms? It doesn't cause signs or symptoms. Doctor might discover after a biopsy to assess a breast lump or an abnormal area found on a mammogram. Male breast cancer is a rare cancer that begins a growth of cells in the breast tissue of men. Everyone is born with some breast tissue, so anyone can get breast cancer. Male breast cancer is rare. It happens most often in older men, though it can occur at any age. What are the symptoms? A painless lump or thickening of skin on the chest, changes to the nipple, such as changes in the skin color or scaling, or a nipple that begins to turn inward, discharge or bleeding from the nipple. Paget's disease of the breast is a rare form of breast cancer. Paget's disease of the breast starts on the nipple and extends to the dark circle of the skin around the nipple. Paget's disease of the breast occurs most often after age 50. What are the symptoms? Crusty, hardened skin resembling eczema on the nipple, areola or both. Itching, redness, a tingling or burning sensation, bloody nipple discharge, a flattened or inverted nipple, a lump in the breast, thickening skin on the breast. Recurrent breast cancer is breast cancer that comes back after initial treatment. A few may have evaded treatment and survived. These undetected cancer cells multiply, becoming recurrent breast cancer. Recurrent breast cancer may occur months or years after your initial treatment. What are the symptoms? A new lump in your breast or irregular area of firmness, changes to the skin of your breast, skin inflammation or area of redness, nipple discharge, persistent and worsening pain such as chest, back, or hip pain, persistent cough, difficulty breathing, loss of appetite, weight loss without trying, severe headaches. Now we should know what are the causes behind those. Researchers have identified hormonal, lifestyle, and environmental factors that may increase your risk of breast cancer. But it is not clear why some people who have no risk factors develop cancer. Breast cancer is caused by a complex interaction of your genetic makeup and your environment. Doctors estimate that about 5 to 10% of breast cancers are linked to gene mutation passed through generations of a family. The most well known are breast cancer gene 1 and breast cancer gene 2, both of which significantly increase the risk of both breast and ovarian cancer. If you received radiation treatment to your chest as a child or young adult, your risk of breast cancer is increased. Being obese increases your risk of breast cancer. Beginning your period before age 12 increases your risk of breast cancer. If you began menopause at an older age, you are more likely to develop breast cancer. Women who gave birth to their first child after age 30 may have an increased risk of breast cancer. Women who have never been pregnant have a greater risk of breast cancer than do women who have had one or more pregnancies. Women who take hormone therapy medications that combine estrogen and progesterone to treat the signs and symptoms of menopause have an increased risk of breast cancer. The risk of breast cancer decreases when women stop taking these medications. Drinking alcohol increases the risk of breast cancer. So now we should know what are the food those are enriched with anti-cancer property. Leafy green vegetables like kale, arugula, spinach, mustard greens, chard, etc. Cruciferous vegetables like cauliflower, cabbage, and broccoli may help lower your risk of breast cancer. Consume allium vegetables like garlic, onions, leeks are all allium vegetables. They are enriched with organosulfur compounds, flavonoid, antioxidants, and vitamin C. Consume citrus fruits like orange, grapefruit, lemon, lime, tangerine, etc. Citrus fruits and their peels are enriched with folate, vitamin C, carotenoids, flavonoids, etc. These nutrients have antioxidant, anti-cancer and anti-inflammatory effects. Consume berries. Antioxidants in berries have been shown to protect against cellular damage as well as development of spread of cancer cells. Consume peaches, apples, pears and grapefruits. Specifically, peaches, apples, pears and grapes have been shown to safeguard against breast cancer. Consume fatty fish. Fatty fish including salmon, sardines and mackerel are known for their impressive health benefits. Their omega-3 fats, selenium and antioxidants like astaxanthin offers protective effects against cancer. Consume fermented foods like yogurt, kimchi, miso, and sauerkraut contain probiotics and other nutrients that safeguards against breast cancer. Consume beans. Beans are loaded with fiber, vitamins, and minerals. Specifically, their high fiber property protects against breast cancer. Consume herbs and spices. Herbs and spices contain plant compounds that help to protect against breast cancer. These contains vitamins, fatty acids, and polyphenol antioxidants. Consume whole grains. Whole grains like wheat, brown rice, barley, quinoa, and rye are rich in variety of important nutrients including fiber, vitamins, minerals, and antioxidants and cancer-fighting properties. Consume walnut. Walnuts have a long list of benefits and are a great source of heart-healthy fats, including alpha-linolenic acid. Some research suggests that adding walnuts and other type of nuts to your diet could even help to protect against breast cancer. Now change your lifestyle. Maintain healthy weight. Overweight is a strong risk factor for breast cancer and any type of cancers. Eat a plant-based diet. Plant foods are rich sources of fiber, antioxidants, and phytochemicals which have been shown to decrease the risk of cancer and protect the body from other chronic diseases such as diabetes and heart disease. Limit dietary fats. Some studies suggest additional benefits from limiting dietary fats in the diet, such as butter, full fat dairy, poultry skin, fatty meats, hydrogenated oils, some margarines, etc. Instead of that, include healthful fats like olive oil, avocado, nuts, seeds, ground flax seeds, fatty fish like salmon, mackerel, sardine, and Arctic char. Consume soybean. Soy is an excellent source of protein, fiber, vitamin B, iron, calcium, and isoflavones, which can possibly help bind estrogen and may decrease the risk of hormone-related cancers such as breast and prostate cancer. Soy also protects bone. Drink green tea. This beverage has strong anti-cancer properties like catechins, flavonoid, etc. Avoid alcohol. Alcohol is a strong risk factor for many cancers, including breast cancer. Maintain bone health and consume vitamin D. It is important for women of all ages to consume adequate amounts of calcium and vitamin D to maintain bone health. Vitamin D deficiency increases the risk of cancer. There is a relation between sugar and cancer. Limit concentrated sweets, added sugar from processed foods and sugary beverages as these foods provide calories but few nutrients. A high intake of sugar can increase insulin levels as well as encourage weight gain, both possibly leading to cancer. Always stay healthy, happy, and think positively. If you enjoyed the video, leave a like, share the video with your friends, subscribe now and press the bell icon to get the latest notifications. Thanks for watching the video.